at this point you're just super excited. Like, stirrups are your best friend. Today was a day of my IUI procedure. This video I'll go over the actual IUI procedure and tell you what to expect at the doctor. I'll tell you how the IUI felt and then I'll answer some of your questions. Full warning, this video might get a little bit PG-13 talk. So mommy, you might want to cover your ears. So if you're uncomfortable with me saying the word sperm, you might want to fast forward sometimes. Welcome to Wannabe Mama. We are headed to the doctor's appointment. We're actually here, we're just sitting in the parking lot. The appointment is at 8:40 a.m. and basically what bless his my husband doesn't like being on camera, so he's not going to be on camera. Today was my IUI procedure. Are you excited? Are you nervous? What are you feeling right now? No, you're not on camera. I just wanted your voice on camera. No, he's shy. I think Andrew is he's like nonchalant. I think he's if it works out, it works out. If it doesn't, he's not going to be sad about it. The first step I did to schedule the IUI was go to the Andrology Lab. If you don't know what that is, that's the sperm bank collecting lab place. You schedule an appointment there for the morning of the insemination, and then they coordinate with the fertility clinic. Update. Andrew said, "What? I am excited." So maybe he doesn't show his expressions very well. So you'll go in the morning, usually 32 to 36 hours after taking an Ovidrel shot, or usually a couple days after the ultrasound to see if you have follicles or not. Here we go. So when you schedule this appointment, they tell you to have intercourse that day of the ultrasound. Do not have intercourse the next day. You want to abstain the day before your IUI, and then after the IUI, you want to have intercourse one other time that day to try to get as many little swimmers up your uterus as possible. So you'll go into the Andrology Lab and you will go to the front desk and they'll ask for your IDs. They'll ask for your IDs like a whole bunch that day, so don't forget your ID because that would be bad. They won't even do it if you don't have your ID. And then you'll sign a paper saying, yes, we're allowed to do this to you, and then they bring you into the back room. This is where it might get a little bit TMI, too much information, but we're all adults here, okay? TMI moment! To answer some of your questions, do they have porn? Yeah. Did we use it? No. Can the wifey go in with the husband? Yeah. TMI. In the little room, they try to make it as comfy as possible. So there was like porn magazines on the side, and then there's a big reclining leather chair. I don't know who would ever choose to sit in that. If you do, you know, props to you, but no. And you can hear things through the wall, like you can hear people walking down the hall. So my tip is just to do it quick and done. Just get it done. This is medical. This is a medical procedure. Let's be serious. So you finish the deed and then you put the little cup inside of like a door, and then once you close the door they pick it out. Then you go and wait in the fertility clinic. There you will wait an hour because it takes an hour to do whatever they're going to do. They take the sperm and they put it in a syringe. And when the syringe is ready, they call you and you'll walk back to the room and everyone knows what you're there for. So you're walking back there and you're like, hey, good luck, thanks, you too. Walking back, and then you sit in this room. They have you show the IDs again, and then they make sure to double check all of your names. They have your names on all the things. So like your papers on the actual box of the insemination, like the sperm box, and then on the actual sperm vial, there's your name as well. So you check all these things because you don't want them split up. That's like my one fear, is that I will accidentally get some really cute Asian baby when my husband's a beautiful not Asian man. They do this so that it's not split up, and so you know that's your sperm. That's it. Just waiting here to start. The sample's over there. And then you will lay down on the bed. Kind of awkward. So you put your legs in these stirrups, and then they come in, they pull out the syringe, and it's like this big with this much actual like semen in it, and then they have a huge needle on it. It was like 3-inch needle, and I was like, ow, 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 ow. But luckily they took that off and they put a catheter on, and the catheter is probably like this big, like 5-6 inches, that it kind of curves like that. and then they say, okay, lay back, and so you lay back. I remember laying on the bed and looking over at Andrew and being like, isn't this romantic? So romantic. You can't help it. Honestly, after trying for almost 3 years, I will do anything to try to have a kid. They put the stabilizer and open up everything up in there, and then they put the catheter through your cervix. So I just had the procedure done. It didn't even hurt, like, at all. I would do this every day. It wasn't even painful. The only thing that was uncomfortable was like the speculum, so like the thing that like opens everything down there, but honestly I couldn't even feel it. So that is a really good sign. Great thing to look forward to. Hopefully it works. So after the procedure is done, you lay down for 10 minutes. I laid down for longer because I didn't realize that she told us to get up after 10 minutes and leave, but I thought she was going to come back in. It's been like 30 minutes. Well, at least the sperm had a good chance to get at the fallopian tubes, I guess. Right now, even though I took the Ovidrel shot, after that shot, the eggs will still be in your fallopian tubes. If the sperm find the egg, it'll take a few days for the egg to travel down and attach to your uterine wall. My body won't be pregnant for at least 2 to 3 days. And I won't officially find out that I'm pregnant until at least 2 weeks from now. I'm hoping it works. The thing that they gave me, like this instruction thing, and they said that the majority of women who become pregnant with this treatment do so within 3 to 4 inseminations. So we are on round 1. There's a possibility that we might have to go all the way to 4 inseminations, so 4 IUIs before we get pregnant. But I'm hoping that it won't come to that and it will happen the first time. Honestly, at this point, you are doing all that you can do. It's up to the big man upstairs, and all you can do is pray and ask and hope that it's going to happen, and just keep the faith. Here are some questions that my friend asked me after the procedure. It only cost $370. That's it. That's including the semen collection and preparation and having the IUI procedure done. I did the math. All together with all the meds and ultrasound and everything, the IUI process, $730. That's it. Second question. So with the IUI, do you bring the sperm with you, or do you have to do it there? With when you get your husband's sperm checked at the beginning of the fertility, finding out why you can't get pregnant process, you can bring your sperm sample there. They want it there within 30 minutes or something, but it wasn't even an option for the IUI. They want you to do it there because they prepare it right away, and I wouldn't want to mess with it anyway because everything has to be sterile because anything can kill sperm. Found out that lube can kill sperm, even if it's not spermicidal lube. At the doctor's office, do you have to, when you lay back, do they elevate your hips when you're laying back after the IUI procedure? The answer is no. You don't have to do that because the sperm is already up in there. So she said it's not going to fall out, but we just have you lay back for 10 minutes just to try to help the sperm not fall back down. After the IUI procedure, you lay back for 10 minutes, and then after that, there's no motion restrictions. I'm going river rafting next week. And I asked her if I'm possibly pregnant then, can I go river rafting? And she's like, yeah. They don't want you to do anything that's gonna hit your stomach, but right now the egg would be so small into your uterus you won't even be able to tell. So you're good. Go have fun, go to the gym, work out, you do you. Don't stop your life until you know for sure that you're pregnant. And then you just have to limit it a little bit. If you like what you see, be sure to subscribe to my channel. I am on Facebook and on Instagram, so you can ask your questions. Guys, I have 3 years of knowledge of infertility knowledge rolling around in my brain. So I want to tell you what I know. You just have to ask me. Thanks for watching Wannabe Mama. Good luck, ladies. Literally his face right now is and he's doing inappropriate things. No. Okay.